Hi everyone, it's Dr. Zach Borus from Dickinson County Board of Health and Lakes Regional Family Medicine in Dickinson County, Iowa. It is September 15th of 2021. It's been about 6 months since I last chatted with you, but I thought it would be appropriate to have a bit of an update. I had hoped that I would not need to be talking to you at this point and that we'd be in a much better spot in terms of COVID than we are by now, but after a few months of lower numbers, we're going back up, and I think it's time to just revisit where we are and what some of the best practices are for preventing illness and keeping each other safe and healthy. So, got a few things I want to talk about today. The main things that I want to talk about are testing, vaccines and booster shots, as well as just the current science of keeping safe, and then treatments. A few pieces of data before we get started really on those. Delta is here. Delta has been here in Dickinson County for about a month and a half or so, and over that time numbers have increased greatly. So we were seeing on average about 10 or less cases per week here in Dickinson County diagnosed, and now over the last 3 weeks we've gone from 10 to 16 to 38, 4 weeks actually, 10 to 16 to 38 to 68 as of today. Over the last week that just came out, there's a 13+% positivity rate. So doing the math, there's a lot of tests being done and a lot of COVID being found. That's a major jump. I'm glad that testing has increased, and we will talk about testing as well, because there's a lot of confusion about who needs to be tested when and how to do so. But also, the hospital has been much busier, both in general, in terms of overall hospitalizations for other illnesses. RSV has been very high, and lots of kids have been ill with that. A lot of people are sticking around in the hospital after surgeries, et cetera, because some of the nursing homes are not accepting new patients or are being very picky about it. And also, COVID has been increasing as well. On average, we've had about 3 to 5 patients with COVID in over the last month or so. 5 was the max, I believe, about a week ago. We're seeing the burden of it. It takes more of our staff, it takes more of our time, and we're happy to take care of these people, but it's challenging, and we again hoped that we would be able to keep people out of the hospital. So we hope that we do not reach the points that we were at last fall and winter, but time will tell. So in terms of testing, there are a number of questions and a number of options for testing. So many people have been calling us about how to test if they're going on trips, or if they're going, or if they need a test for work, things like that. Probably the best way that you can do that is to pick up a PCR spit test or a saliva test from one of the 2 east or west entrances of the hospital. They will have supplies of those. It's sent into the state from your home. You take it home, you spit in the vial, you put all your information in there, and then you put it in a UPS box, and it goes there, and it's resulted within 24 to 48 hours. Actually very slick, very effective, and you don't have to have your brain tickled. So that's nice. That has replaced the Test Iowa program, and while there have been some calls to restart the Test Iowa program formally with the PCR testing, the state has not yet done so. So this is our best option. You can also get some of those kits sent to your home directly if you go to testiowa.com and fill out the application for that. So that is a PCR test. If your airline requires a PCR test, that is one way to get it done. Otherwise, here in Dickinson County, you can call our office at Lakes Regional Family Medicine at 712-336-3750 and talk to your provider's nursing staff, and they will sort of triage you and see if you need to be seen for a full appointment and evaluated, which many do, or whether you can just come in and get a test, whether it's PCR or rapid, depending on the situation. Rapid tests are not good for folks who do not have symptoms, but if they've been exposed, doing a PCR test if they don't have symptoms makes sense. So if they do have symptoms, we generally want to see you because we want to make sure that you're doing okay. So again, call the office. We will get you set up for what you need to be tested. We do have good supplies of the antigen tests. We do have good supplies of the PCR tests. Turnaround time for the PCR tests is generally 24 to 48 hours as well at this point. just depending on when it gets out to Sioux Falls. So we're in pretty good shape in terms of testing, but wanted to clarify those. In terms of safety, I mean, really, other than a couple months there after the CDC recommended that people with the vaccines didn't have to mask all the time, the recommendations haven't changed. So generally, it's the same stuff we've been telling you for the last 19 months. Wear a mask at all times when you're inside with other people outside of your household. And now that is whether you're vaccinated or not, because we now know that vaccinated folks, while still far less likely to get severe illness, can still carry it and can still transmit it. So recommendation for the safety of yourself as well as others would be to wear a mask when you're inside somewhere. That includes kids over 2. That includes people at schools, kids at schools, as long as you can't socially distance for at least 6 feet. Delta is also much more contagious, and so that 6-foot rule is a lot more gray. And so, again, wearing a mask is your best protection, and if everyone does so, then the virus is generally better controlled and not spreading between you. There's also a lot more data about the types of masks that are most effective. So we do now know that a tight-fitting cloth mask is good. So it's the one that is the most tight to your face and that has the most filtration. So a cloth mask, ideally with a filter in it, is better than just a plain cloth mask. A surgical mask that is tightly fitting is probably better than that. A combination of both. So a cloth mask over the surgical mask. The surgical mask acts as a filter. So again, that's probably better than one or the other. And then KN95s or N95 masks, which are now more available. You can go on Amazon and get KN95s, which are in all sorts of different colors and shapes and otherwise, will protect you more because they filter more of the particles. So think about it, but again, if everybody were wearing even a cloth mask, there would be far less transmission right now. And then the rest of it that you've heard many times before: continuing hand hygiene, continuing social distancing as much as you're able, and not sharing drinks, etc. So third thing I want to talk about is vaccines. So we are getting a lot of calls about boosters or third doses. Currently they are available through Dickinson County Public Health as well as the pharmacies locally for people specifically who have immunocompromise. So people who are on high doses steroids, people who have had a transplant, people who are on immunomodulating medicines for rheumatoid arthritis and things like that. Just that specific group is currently allowed to get a third dose of the vaccine, and that would be either Pfizer or Moderna. And we do recommend that you get the same one that you started with. Otherwise, there's been a lot of talk about won't there be boosters or third doses recommended for Pfizer and Moderna for the general public? We don't know yet. It's sort of conflicting data. It is likely to boost your immunity much more than just having 2, especially given the time frame between the 2. They have been saying probably 8 months from your second shot. We don't know yet. Just keep your ears open, and we will give you as much information as we can when we know what the recommendations are. That should be coming out in the next few weeks from the CDC and the government. I do recommend getting them. Vaccines are the best way to prevent severe illness. So we now know that yes, you can carry COVID or have mild to moderate illness, which stinks even if you've been vaccinated. It's true. That said, you're 11 times more likely to die of COVID if you are unvaccinated versus vaccinated folks. You are about, at this point, seems like 80 to 90% of the folks nationally who are hospitalized are unvaccinated. That is what is causing our overwhelm at hospitals nationwide. So I'm not going to get into politics. I'm not going to get into mandates. That is well above my pay grade. That goes elsewhere. But from a science standpoint, they are safe. They do not cause infertility. Pfizer is now fully approved through the FDA, not on emergency use authorization. They have all been given in hundreds of millions of people worldwide, and there's tons of post-marketing data on it, and they are safe, they are effective, and they will prevent severe illness. Even the mild to moderate illness with COVID can be severe versus what you've had before. So, you can get very ill, you can have respiratory compromise that lasts for some time, you can just feel awful. So even if it's a mild case. So if you're not vaccinated, talk to your provider, or you can come to Dickinson County Board of Health or Public Health. You can come to our clinic where we have them, both Moderna and Pfizer. You can go to Hy-Vee or Walmart and get Pfizer or Moderna respectively. And I believe that Lewis does have some Johnson & Johnson for those of you who are looking for that one shot. That said, it's somewhat less effective than the other two, and so if you have your choice, I'd probably recommend Moderna or Pfizer. Yeah, so that's generally what I wanted to talk about. Treatments is the last thing. So we've gotten a lot better about treating COVID and helping prevent severe illness. We are, for the folks who are in the hospital, if they are needing oxygen, they are getting the remdesivir that they've given, they are getting steroids, which are cheap and effective and probably the best thing we've got. And there are a few other new medications that are approved for those who are severely ill or on ventilators. Additionally, for those of you who meet certain criteria of being high risk, whether you are over 65 or have chronic lung or heart issues or are actually over a BMI of 25, which is actually just slightly overweight, you would qualify for the monoclonal antibody therapy if you test positive. So that can be done within the first 10 days of symptoms as an outpatient. Again, you'd call our office and we'd see you and schedule you for that through our outpatient center. They help reduce hospitalizations by 70+%, and that's in people who are vaccinated or not. So good treatment, not as good as preventing it in the first place, but still those are available. And so right now we have Regeneron. There's also bevacizumab bamlanivimab, and so we have that available. There have been shortages in certain parts of the country of it, but right now we're in good shape. So if you do get COVID, or if you are diagnosed at home, or if you've taken a home test and haven't been to the doctor, but you might qualify, then certainly give us a call. That's sort of where we are. So again, please go with the science. There's a lot of misinformation out there. There's a lot of fear, and there's a lot of talk about things that aren't really effective being pushed. So I would just encourage you to, listen to your trusted sources, whoever they might be. My trusted sources are CDC, American College of Obstetricians and Gynecologists, American Academy of Family Physicians. These are organizations who are tasked with figuring out what's best in terms of the treatment of illnesses based on the science that we have. Sometimes that science changes, as we saw about the masking versus not masking for vaccinated people. Now we're back to masks as best practice, but that's because the illness has changed. Delta is different from Alpha, which is different from the original one. So as usual, I'm being long-winded, but I just had a lot to talk about. Thank you for your time and effort, and please don't hesitate to reach out to your providers here at Lakes Regional Family Medicine to ask your questions. All of the providers here at Lakes Regional Family Medicine are supportive of the vaccine, supportive of people getting tested and getting treated. So if you have questions, let us know, and have a wonderful day. Keep taking care of each other, and keep yourself safe. Thanks.